The University of the Philippines, the only Philippine university to be named in the top 100 universities in Asia. This state-run institution is a paragon of education steeped in history and culture. The University of the Philippines system is composed of 8 universities around the country. The oldest of which is the University of the Philippines, Manila, the birthplace of the UP system in 1908 in Padre Faura Ermita. Its oldest unit, the Philippine Medical School, later renamed to UP College of Medicine, opened in 1905, followed by the Philippine General Hospital in 1907. From the College of Medicine evolved other colleges and units that diversify the university's course offerings. In 1948, UP was transferred to Diliman, Quezon City, leaving behind some health colleges and the College of Arts and Sciences. In 1976, the School of Health Sciences was created in Leyte to offer a community-based, ladderized health education that aimed to help increase the availability of trained health workers in the province. 2 satellite campuses of the school were strategically set up in 2 other remote and underserved provinces, namely Baler Aurora and Coronadal, South Cotabato. The creation of the Health Sciences Center in 1977 brought together all the health units under one roof. The center was renamed to UP Manila in 1983. Today, UP Manila is the recognized pioneer and leader in health education, research, and public service in the Philippines. Among its pioneering programs are university-wide BS Nursing, Master of Arts in Nursing, PhD Nursing, Master of Health Professions Education, Integrated Arts and Medicine, degree programs in Public Health, MD PhD, MA Health Policy Studies, MS Health Informatics, MS Genetic Counseling, PhD in the Health Sciences by Research, and the only ladderized midwifery, nursing, and medicine degree program of the School of Health Sciences. UP Manila's credentials have led to its being the partner of choice of the World Health Organization, Department of Health, Department of Science and Technology, Commission on Higher Education, and other local and international groups to achieve health reforms. UP Manila is the only campus in the UP system that offers education, research, and training in a wide array of health disciplines and professions. The university offers courses in medicine, nursing, pharmacy, dentistry, allied health sciences, public health, health professions education, community health, and the arts, natural, and social sciences. The competency-based curriculum makes it stand out among the other schools. Since 2014, in compliance with the Philippine Qualifications Framework, the colleges are now transitioning to outcome-based education, or OBE. It enables the well-rounded development of students and unlocks their full potential as both health professionals and dedicated Filipinos. UP Manila educates the brightest students in the health professions and allied social science disciplines. Its students consistently top licensure examinations and assume positions of leadership and influence in government, the private sector, academe, non-government sector, and the community, giving them opportunities to shape national policies and programs on health. UP Manila is a pillar in the field of health research. UP Manila ensures that its faculty, staff, and students engage in research as a tool for health reforms to enhance education and complement its public service role. With the help of the National Institutes of Health, the center of and coordinating body for all researches in the university, UP Manila's researches have served as basis for national policy formulation and program planning. UP Manila's firsts in health research and policy include Republic Act 9288, the Newborn Screening Act of 2004, RA 9709, Universal Newborn Hearing Screening and Intervention Act of 2009, RA 10747, Rare Disease Act of the Philippines in 2016. Other advocacies include the studies on liver diseases that led to the mandatory vaccination of newborns against hepatitis B, commercialization of Lagunti and Sambong as proven effective medications for cough and colds based on the results of the National Integrated Research Program on Medicinal Plants, the Ventilator Project, and the Vision Screening Project for newborns and school children, all of these for healthcare improvement. Strengthening this role is its public service function rendered through the Philippine General Hospital, its community and volunteer programs, and scholarly and technical assistance to the government, private sector, and civil society. As the Philippines' biggest government and tertiary hospital, the PGH sees more than 500,000 patients a year from all over the country. It trains thousands of health students and health professionals from within and outside the university. Among its innovative programs are on child protection and poison control and management. Volunteerism is strong at UP Manila. From the very beginning, students are ingrained with their role as public servants. Through the ugnayan ng pahinuod, faculty, students, staff, and alumni volunteers provide health and socio-cultural services that benefit depressed communities and indigent Filipinos. And to further reach out to the larger society, UP Manila offers the Community Health and Development Program and other community-oriented programs. This combination of excellent education, relevant research, and public service has produced thousands of exemplary doctors, nurses, dentists, pharmacists, public health experts, rehabilitation workers, paramedical workers, and more. With more than 100 years of excellent leadership in health, UP Manila is keeping itself nationally relevant and globally competitive by being at the forefront of Philippine health. The challenge may change, but UP Manila's response will be certain, excellent, relevant, and transformative.
Personally, HIV affected me from a personal level, where I lost so many relatives to HIV when I was in high school.
I'm interested in how I can track and identify infectious disease outbreaks.
This summer, I got the opportunity to work on an adolescent HIV intervention in Cape Town, South Africa.
I wanted to dig deeper. I wanted to be actually part of the story.
Somebody had to do something, I wanted to make that change. I knew I have to do public health.
I was really interested in Brown because of their focus on learning public health by doing public health.
I like how there are many different research centers that allow different students to find what they're interested in, what they're passionate about.
One of the things that's different about Brown is we've got a lot of faculty and we don't have that many students. It's not that difficult to find a faculty member who's working in the area that corresponds to your interests.
So my first week here, my first class with Dr. Lurie, I asked him after class if I might be able to work with him, and he agreed. He's been helping me develop my research interest, and he's my thesis advisor now.
Brown was so open to allowing me to meld my work with my school experience. So it was going to make it possible for me to do both things at the same time.
What I love about Brown is the multidisciplinary, where it's not just one department. You can transfer and work with other members from other departments like epidemiology, biostatistics, health services.
I think there's several reasons that students choose to come to Brown. Of course, they love the idea of being able to design and to participate in the design of their own curriculum and their own experiences, learning by doing public health. And they have the whole university at Brown at their disposal to develop their skill sets and their knowledge base.
All the professors are incredibly accessible, and a lot of them work in the field. So they're not just academics who have a conceptual understanding of public health, they're actually doing public health all the time. So they draw that experience into their lessons.
I think a central part of our philosophy is that students should be learning both in the classroom and in their hands-on experiences out in the real world.
And in the afternoons, I would get the opportunity to go out to local sites in the townships around Cape Town to see firsthand what all my learning in my classes was doing to have a positive impact on the people in Cape Town was something that was really fulfilling for me.
At Brown, we learn public health by doing public health.
I learn public health by doing public health.
I'm learning public health by doing public health.
We learn public health by doing public health.
I learn public health by doing public health.
The HIV COVID-19 webinar series is sponsored by the University of Philippines Manila, Brown University Training Program for the Prevention of HIV in Vulnerable Populations. This D43 HIV training program began in 2017, funded by a grant from the U.S. National Institutes of Health, Fogarty International Center. The HIV training program is led by Dr. Don Operario from Brown University, along with co-investigators Vice Chancellor Nimia Pimentel Simbulan and Laura Fred Hernandez from the University of Philippines, and Dr. Susan Kuuven and Katie Biello from Brown University.
Before we start the webinar, please be reminded of the following house rules. Turn off your cameras and mute your microphones during the webinar to avoid interruptions. We wish to also ask our participants today who are in Zoom to please use the chat box to write your comments and questions to the panel. For those who are joining us via Facebook and Twitter, we ask that you use the comment section to give us your questions and suggestions. Thank you. Welcome everyone to the UP Manila and Brown University HIV and COVID-19 webinar series. I am your moderator for today. I am Maria Irene Colantang. I am an assistant professor from the University of the Philippines Manila and currently an NIH-Fogarty Fellow at Brown University. With me as my co-moderator for today is Professor June Gregorio of the Department of Health Promotion and Education at the College of Public Health at the University of the Philippines, Manila. Professor June has done several studies on HIV/AIDS, including a knowledge, attitudes, and practices survey on HIV/AIDS among high-risk and rich populations for the International Federation of the Red Cross and the Philippine Red Cross. He recently led a group of researchers completing a study on knowledge, attitudes, and practices on COVID-19 and COVID-19 vaccination funded by the National Research Council of the Philippines and the Zweilig Family Foundation. Professor Gregorio has published more than 30 papers on social behavioral aspects of infectious diseases, adolescent health, school health, and mental health promotion in peer-reviewed and Web of Science journals. He is an advocate and a trainer of health leadership and governance for local chief executives and health officers. Today's session is the second session of the 5-part HIV and COVID-19 webinar series. 2 weeks ago, we finished with the first webinar and we talked about the emergent challenges and innovative responses of different institutions in terms of providing HIV services to the PLHIV community in the Philippines. We still have 3 more webinars for all our participants. The third one is on vaccination, the title of which is Who is Next in Line? Considerations and Guidelines in Vaccinating the PLHIV Community in the Philippines. Here we're going to talk about the vaccination protocol and the different issues regarding vaccination among PLHIV. For the fourth webinar, we're going to talk about communities and COVID-19, where we're going to have a roundtable discussion with community-based organizations in the Philippines and see and learn from them in terms of how they adapted their services to ensure the continuous provision of HIV service to the PLHIV community in our country. And after that one is a culminating webinar, which is entitled Next Steps, the Post-Pandemic Philippine HIV Epidemic Response. This fifth webinar will wrap up the webinar series and talk about what we have learned so far from all our panelists across all 5 webinars, and discuss and present what steps we will do in the future to ensure that we have learned something from our experience of COVID-19 and service provision to the PLHIV community to make sure that our services are better moving forward. As for today, we're going to talk about the experiences of the PLHIV community during the COVID-19 pandemic. We recognize the importance of listening to those who are directly affected by HIV and learning from them to be able to improve the services that we provide the community. Because really, what the community needs, what the community can do, only they can tell. And so it's important that we listen to them. We also recognize that there are many varying experiences of living with HIV, and having only 3 speakers and talking about this for only an hour and a half may not be enough, but we wish to give you a glimpse of the PLHIV experience through the experiences of our esteemed speakers today. Before I pass on the mic to Sir June to introduce our speakers, I would like to remind everyone to please invite your friends to tune into the webinar via our Facebook accounts and our Twitter accounts. We're being live streamed now via the UP Manila official account and the UPM-Brown webinar accounts, and also with Subselfie and Reporter.world. So Sir June, I'll pass on the mic to you to introduce our session objectives and our speakers.
Yes, thank you, Prof. Irene, for your kind introduction. Good morning, good afternoon, and good evening to everyone. So again, I'm Prof. June Gregorio from UP College of Public Health. Okay, so as mentioned by Prof. Irene, this session is entitled COVID-19 Narratives and Realities of PLHIV Communities. And our session objective for this for today is number 1, to share the experiences, the challenges, and good practices on access to HIV/AIDS care and services during the pandemic. And number 2, to identify areas for support to address the challenges shared, as well as the mechanisms in which the support can be best provided post-pandemic. So we are very fortunate for today to have with us 3 distinguished panelists who are all HIV prevention and control advocates, which I am going to introduce one by one. Our first panelist is Owie Franco. He is the current president of Pinoy Plus Advocacy Pilipinas Incorporated, which is a support group dedicated to the welfare of PLHIV in the Philippines. Pinoy Plus implements community-based HIV/AIDS prevention, treatment, care, and support services to those infected with or are affected by HIV/AIDS. So Owie is a former OFW and was diagnosed with HIV in 2004. He became a member of Pinoy Plus in 2007 and was first elected as the organization's president in 2016. He was again elected as president in 2018 and continues to serve in that position and up to the present. So Owi is a permanent representative of Pinoy Plus in the Philippine National AIDS Council or PNAC. He also serves as the project coordinator of Pinoy Plus under Asia Pacific Network Plus project and is also a certified DOH counselor and a CBS or community-based motivator trained by the DOH. He is also a representative of Network Plus, an umbrella organization of PLHIV groups in the Philippines, with more than 40 member organizations nationwide. The organization is positioned to be a platform. The network is positioned to be a platform for the community's truly meaningful engagement in developing, implementing, and influencing the national response to HIV. The second panelist is Desi Andrew Ching. He has been living with HIV since 2007. Born in Manila, Drew grew up in the Filipino-Chinese community and was schooled in a Protestant Chinese school. He went into medical technology studies for pre-med and briefly entered medicine but shortly dropped out to take his business degree, and he eventually obtained a master's degree in business administration. Having spent decades in the corporate sector, food and banking industry, Drew in 2012 decided to retire early and focus on the HIV community following reports of close friends who passed from HIV-related conditions. He is a co-founder of PLHIV Support Group, REDX, and currently seated as board president and interim executive director for HIV and AIDS Support House, or HASH. He is an activist and an advocate for HIV care cascade programs with focus on PHLIV quality of life and rights. A volunteer, a community member, a programs person, Drew is a proponent of the 2019 HIV Policy Act, community-based HIV screening and client-centered case management in the country. On a personal note, Drew was a former student of mine in a medical technology school and our president in the HASH board, where I am also serving as a volunteer board member. The third, but not the least panelist is Alvin Tony G. Fernandez, President Spectra LGBT of the Department of Health, Region 9. He is also the president of LGBT Federation of Zamboanga City. He attended the Outright Summit in 2018, held in New York City, USA, funded by Outright Action International. He also attended the World Health Organization study visit in 2019 as a Philippine delegate to Melbourne, Australia. He is also the executive director of Mujer LGBT Organization Incorporated. Okay, so this session will depart a bit from the traditional webinar format where you have slide presentations by speaker, but we will use a roundtable discussion or a group discussion with our experts. So to begin, I'd like to pose the first question to our panelists. Can we have them on the screen? And Professor Irene Kilantang will be co-moderating this session with me. So the first question is, can you please describe the experience of accessing HIV, AIDS care and services before the pandemic, and how it is different from your experiences during the pandemic? So please feel free to respond, to give your experiences and your narratives. Anyone would like to start? Tony G, would you like to start? I can see your face.
Yeah, sure. Thank you so much. No, before the pandemic, the numbers of clients visited or accessing our services here in the community center, mataas siya, no? compared yung nakaroon tayo ng pandemic. We see, nakita namin the barriers why our client cannot be able to visit or to access our services. It is because of the quarantine classification na inimpose ng ating government. And of course, the quarantine pass na wherein restricted ang movement ng ating mga clients. That's why the organization, the Mujer LGBT organization, with the support of Department of Health and the Zamboanga City Medical Center Treatment Hub and the Social Hygiene Clinic of the City of Zamboanga, we launched the Ronda Mujeres, na wherein we bring the services sa community. We really have to address the gap, no, the barriers. Bakit sila hindi makapunta? Because of the restriction of the quarantine. So we bring lahat ng commodities dinadala namin sa community. Actually, it's a 1-week activity, no, outreach activity sa far-flung areas. And at the same time, we coordinated with the treatment hub dito sa Zamboanga na kung saan the PLHIV nagme-message sa kanila, coordinating with them and to refill their ARV drug for the antiretroviral drugs. And the treatment hub will endorse that to us at kami na mismo ang nagdadala ng ARV sa ating mga PLHIV communities na kung saan affected mismo sa quarantine classification na inimpose ng ating gobyerno. So basically, if we compare the numbers of clients na nang-access sa services natin pre and post, during pandemic and before the pandemic, mababa talaga. So, but then again, we have to re-strategize and we have to address that gap, and that's what we're doing now. We keep on communicating with our partners, and to be able to have an innovation approach para sa ating community. Yeah.
Thank you, Tony G, for sharing your experiences in Zamboanga City. Can we hear from Ovi Franco? Ovi?
Hello, good afternoon, everyone. Yes, sir. In NCR, Pinay Plus is based in Manila. So, malaki impact ang pagkakaroon ng pandemic during last year hanggang ngayon. For example, ang ERV delivery, yung pagpunta ng mga PLHIV sa treatment hub facility, ay naging malaki yung restriction ng pagpunta. Lalo, kasi yung takot ng mga PLHIV na magkaroon sila ng fear, na magkaroon sila ng COVID virus, tapos may HIV patient na sila. For example, like ako, more on delivery yung ERV ko that last year hanggang ngayon ay hindi pa rin ako nakapunta ng treatment hub ko. Pero malaking impact na malaking tulong din yung nagawa. Like for example, naglabas ng guidelines ang Department of Health na magkaroon ng, kung ako, for example, ako ay RITM, pwede na ako mag-access ng ERV o treatment sa mas malapit na area ko kung saan ako located. For example, kung ako ay Quezon City, doon ako pwede mag-access ng ERV refill ko. So yun yung malaking practice good practice during the pandemic. Yung nagkakaroon ng malaking hindi siya naka-restriction yung hub mo lang ay doon ka lang pwede mag-refill. So nung pandemic, pwede ka na mag-refill kahit saan. Pangalawa, yung nagkaroon ng initiative ang CSO like ang the Reed Wiesel Foundation, UNAIDS Philippines, and TLF Share. Nagkaroon silang ERV Bayanihan. Parang mas naging accessible yung pag-access ng treatment. Yung ERV courier nila ay mas dinideliver na lang sa bahay yung mga ERV nila instead na pumunta sila sa treatment hub. Ang challenges lang po ay yung, kasi hanggang ngayon, malaki pa rin yung challenge na malaki yung nag-lost to follow-up in terms of health monitoring status. Kasi more on, yung ERV refill, nandyan siya, nakaka-access ng mga PLHIV. Pero yung health monitoring status, kasi more on treatment hub ay wala pong teleconsult o online teleconsult medicine. So hindi po lahat ng treatment ay meron pong ganon. So meron pa rin mga naglo-lost to follow up in terms of health monitoring status nila. For example, kasi for example, ang ibang treatment hub kasi may ginagawa silang refill na every 3 months dapat mag CBS ka o yung blood chem mo dapat nakakontrol. Pero yung iba, during the pandemic kasi, medyo naglalos yung mga patients sa ganun kasi yung takot nila magpunta ng treatment hub. Yun po, sir. Thank you.
Thank you, Ovi. Can we listen to Drew? Drew?
Hi, good evening. Hi, good afternoon, and good morning and good afternoon to everyone. Thank you for having me as part of the panel. Let me answer or respond to the question by going through the cascades of HIV services, starting off with prevention. Paano ba ang nangyayari sa prevention before and during the pandemic? Before, the community or our organization was greatly involved in educational sessions with different companies and schools. We had to cancel them during the pandemic or after the lockdown was implemented. So we are able to maintain the health status of our volunteers or especially of our people or trained people doing education sessions with the different partners. Prevention was also greatly affected in terms of pre-exposure prophylaxis. PrEP was something that we started offering Q4 of 2019, and a lot of our clients on PrEP had difficulty accessing PrEP during the pandemic, not because they could not access hash for PrEP refills, but primarily because a number of them were dislodged from their employment. As a result, they cannot afford PrEP and the career expenses attached to the delivery of PrEP. Most of our clients in PrEP or pre-exposure prophylaxis are male sex workers, and the pandemic had a big impact on their livelihood. In terms of that's for prevention, no? In terms of testing, we have been told by the Department of Health, as recently reported, that the 2019 to 2020 testing went down by as much as 61%. That only shows na the activities of screening and testing around the country went down by more than 50%. The COVID lockdown greatly affected access to testing, especially that many local government unit clinics had to control the number of operating hours. A lot of their staff had to be assigned doing COVID-related services. Going to seeing clients as well because of the lockdown. Mobility was greatly affected. So us going to the house of the client or meeting the client was a difficult task for the volunteers, unless the clients would go knocking on our doors for testing.
Drew is I think he was disconnected, so we'll go back to him. Thank you very much for sharing your experiences before and during the pandemic. And Desi, Drew is here already. And thank you, Drew, for sharing your experiences through the cascade of care. And those are very informative information. Actually, the next question is about challenges, and many of you already spoke about the challenges that you encountered in in accessing care. Our next question is, maybe you would like to discuss some issues related to accessing care. For example, what are the confidentiality issues, privacy issues, difficulties in in disclosing or not disclosing the status when you access the services. Tony G, would you like to share your thoughts about this?
Yeah. Thank you so much, no. Uh, as I've mentioned kanina, when it comes to accessing sa testing and sa ARV medication, no, because of the quarantine classification, our PLHIV clients nahihirapan. Because first, like in Zamboanga City, meron kaming QP pass na kung saan ang per household, 2 tao lang nakakalabas. And let's not forget that there are PLHIVs na hindi din-disclose ang kanilang HIV status sa kanilang family. So basically, their family doesn't even know na yung HIV status nila, no, if they are HIV positive or not. And secondly, yung name ng QP pass ay hindi sa kanila. So basically, yung movement nila is very restricted at hindi sila makakalabas doon. So how can they refill their ARV, or how can they access the testing or access the commodities if mismo doon sa bahay hindi sila makakalabas because of the QP and quarantine classification na in-impose ng ating government, diba? So basically, and to address that, that's why we, the organization, we took the initiative to collaborate with our partners, government agencies, and the LGU to tackle this issue, no, to address the gap. That's why from that conversation, we launched the Ronda Mujeres na kami na mismo ang pupunta from East Coast to West Coast to Zamboanga City, na wherein ang ating mga PLHIV, hindi na sila mag-worry na dadaan sila sa checkpoint. Kasi there are times, even the checkpoint personnel, no, nag-implement ng checkpoint, they are asking, what you're doing? Anong gagawin mo sa hospitals? Bakit ang gagawin mo doon? So, malaking probability that they will disclose it. So, they are not comfortable to that. So, basically, confidentiality ay nagiging issue din dito sa quarantine classification natin. And, yeah.
Before Sir Owie answers the question that was posed to Tony G. Tony G, I was wondering if you can talk more about the process of making requests for deliveries, because you said it's now the system now allows you to bring the medication to the PLHIV. I was wondering how the process would look like from making the request up until delivery. Do they make the requests online, via text, via phone call?
Right.
Actually, the treatment hub, they have a direct contact with the PLHIVs, to their clients. And our PLHIV clients, they would request, they will coordinate to the treatment hub, and they will share their stories that, for example, di sila makakalabas doon, and they need the medication, they need the ARV drugs because wala na. They need to urgency na kailangan na i-refill. So si treatment hub, they will communicate with us, and kami naging parang bridge para dalhin yung ARV drugs sa ating PLHIV client. So basically, may ganong conversation nangyayari. So hindi basta-basta kami pupunta doon sa community without the consent of the client, without the consent of the treatment hub, because the ARV drugs ay galing mismo sa treatment hub na sila nagbibigay sa amin, and with the instructions as well.
Yeah. So Tony G, it is your group that will meet the person at a place that you agreed upon, but because you are not, you don't go to the house of the PLHIV, right? You set up a place where to get the medicine.
Yes, you're right, sir. So it's dependent to the client kung saan sila komportable. So may meeting place talaga. So some of them are 100 meters away from their residence. Some of them parang sa labas lang din sa bahay nila. So depende pa rin sa client, sa case-to-case basis, kung saan sila komportable. Because we believe our services, we are client-centered. So sila ang importante, kung saan sila komportable, doon tayo.
Okay, thank you, Tony G. So can we now proceed to The response of OE?
Siguro sir, add-on lang din po with kay Tony G. Tama po siya. Malaking impact din po yung, lalo na nagkakaroon ng restriction, lalo na pag ang isang PLHIV na lockdown ang area niya, nahihirapan din mag-access ng ERV niya. Lalo na kung hindi disclose yung status ng isang PLHIV sa isang community nila. So mahihirapan i-avail yung ERV nila. Lalo na, for example kasi, si Pinay Plus kasi meron siyang initiative na programa ng PLHIV Response Center Hotline. So during the pandemic, maraming queries na natatanggap. For example, yung nagkakaroon ng restriction ng area at naabutan ng lockdown. And then, yung pagkakaroon ng, kasi ang ERV ba yan, last year lang siya natapos, pero yung pandemic natin ay hanggang ngayon tuloy-tuloy pa rin siya. So, nag-end yung ERV bayan niyan. So, karamihan pa rin sa mga PLHIV ay nahirapan pa rin mag-access kasi limited yung transportation natin hanggang ngayon. So, or minsan naka-priority ang treatment hub nila sa COVID patient. So, some treatment hub ay naka-close siya for PLHIV patient. So, at yung takot pa rin ng PLHIV na pumunta ng treatment hub, baka ma-acquire nila yung COVID. So, ang problem ngayon, yung pag-access ng ERV refill nila, ng pag-ipakukourier nila, kung indigent yung PLHIV, wala silang mapagkuhanan na pambayad ng delivery ng ERV nila. So, may good thing din na merong mga initiative. For example, ang Achieve ay, pag former migrant ka, meron silang funds na pwede mong lapitan para i-avail o ma-access mo yung free courier na delivery mo pag former OFW ka. Yung ERV ba yan kasi nag-end na siya last year. So, yung pandemic natin, tuloy-tuloy pa rin hanggang ngayon. So, yun yung worried namin. Kasi mayroong nilabas sa PhilHealth na dapat i-under siya sa OHAT yung courier service delivery ng ERV. Pero, hindi siya implemented ngayon sa lahat ng treatment hub. Parang, konti lang yung hub na merong nag-i-implement to i-charge sa OHAT yung delivery ng ERV nila. Yun lang po, sir.
And
Ovi, just sige.
Yes, sir. Go ahead.
Ovi, just a follow-up for the interest of those who are not familiar with the ARV Bayanihan.
Yes,
so you mentioned that it was developed, conceptualized by the Department of Health. Is that correct? And
No, sir.
Can you please explain more about the ARV Bayanihan?
ERV ba yan sa initiative po ng isang CSO at na in partnership with the UNAIDS Philippines at ang TLF Share, isa po sa nagpa-fund din, nakasama. Ito po yung programa na ginawa during the pandemic na kasi yung pag-access nga ng ERV. So, ang ginagawa po nila kasi meron namang mga case manager or sa mga treatment hub, kung si PLHIV ay nahirapan mag-access ng ERV nila at wala sa indigent siya, pwede nilang lapitan si ERV bayan niyan. Siya yung sasagot, siya yung magbubook ng, si PLHIV ang magbubook, pero ang magbabayad po ng ERV courier nila, si ERV bayan niyan program po.
Okay. So it's civil society, okay.
Civil society. It's our Bayanihan is initiative by the Red Whistle po with Sir, before we proceed with the next question, I was just wondering because most of the challenges and the services that you've mentioned focused on medication. I was wondering if you have any experience in terms of mental health na service provision, counseling, especially because the pandemic is a really very stressful time, not just for PLHIV but for everyone. And also in relation to that, there's a question in the chat box that this has been posed to you. If you were able to document cases of harassment and discrimination sa PLHIV community natin during the lockdowns. I've read some news regarding harassment pag magsasubmit sila ng pass nila para punta sa ibang barangay or to do something else because they're asked bakit lalabas, ano yung purpose, and sometimes you can't disclose na I'm gonna get my ARV. There's also cases ng harassment lalo na sa transgender na community natin and LGBT community in general. So I was wondering if you can talk more about that.
Ma'am, siguro yung example yung sa psychosocial ng kasi totoo po 'yun, during the pandemic maraming PLHIV na na-affected during yung mental health nila. Kaya po si Pinoy Plus Advocacy Pilipinas ay nag-create for yung learning group session namin ay dati ay face-to-face siya, then nag-transfer into online. Ang tinatawag po namin kamustahan ng mga peers. Is a safe space for PLHIV community for learning group session. Depende po sa topic na tinatakal namin. Ito po ay funded with the TLF Share and Philippines Health Foundation Philippines. Sila po yung nagpa-fund ng kamustahan ng mga peers namin. During the kamustahan kasi, pag example, ang topic namin ay may invited kami na doctor, the psychologist po. So doon namin nakukuha yung problem nila na meron pala mga PLHIV na nagkakaproblema during the pandemic at naapektuhan yung mental health nila. Like yung nagkakaroon sila ng depression kasi hindi nakakalabas, nagkakaroon ng anxiety kasi nawawala ng work, yung mga ganung bagay po. Ayan, totoo po yun ma'am, yung for example, yung naaabutan ng restriction, for example ay, di ba, like yung isang tao ay nasa Tarlac, hindi na siya makalabas, papasok ng Maynila, at para mag-refill lang siya ng ARV. At marami pa rin dokumento ang hinihingi. Pag pinipresent po yun, malaki po discrimination kasi minsan po yung tao doon na nasa checkpoint ay hindi po alam yung status ng isang PLHIV or walang kaalaman o may kaalaman man pero hindi siya sapat. Parang ganun yung nangyayari. Yun po yung mga discrimination na karanasan po ng mga PLHIV din. Pangalawa ma'am yung, kasi malaking bagay po yung, kasi dati before nag-pandemic kasi kasanayan natin ng mga PLHIV ay nakaka-refill sila ng 3 months. During the pandemic, nakaka-access na sila ng 1-month refill, 1-month bottle ng ARV. So, during the pandemic, malaking impact kasi parang hassle din po sa isang PLHIV na ang isang treatment hub, magbibigay ng isang bottle lang ng ARV para lang makapunta tapos pabalik-balik every month papunta-punta yung isang PLHIV doon. Malaking hassle po sa PLHIV kung ang PLHIV ay takot nga po sa. So, yun yung mga bagay-bagay na sana ma-address ng Department of Health o yung treatment hub natin na matugunan yung mga ganung concern ng isang PLHIV po. Yun lang po. Thank you.
Thank you, Owie. So can we go back to Drew? Maybe you continue what you were saying earlier and maybe add also on the questions raised earlier. Drew?
Yes, June, thank you. The issues are similar naman, no, in terms of accessing service, treatment and care across the different regions. We have had reports around people not being able to access their meds, around people not being able to get through quarantine checkpoints, hence making it difficult for them to access their meds. Also, we have seen efforts of the civil society organizations to help with the AR Bayanihan, as mentioned by OWI. We at HASH did launch the project head, the HIV emergency ARV delivery around the same time then, to provide for free career services. The difference is that the process is we're able to serve different clinics, different patients from different clinics in different regions and even different countries as far as Europe to send their ARVs, and we are able to pay for their career charges with the support from the National Council of Churches of the Philippines. So whilst tumatakbo yung AR Bayanihan at the time, we had a similar simultaneous program called Project Head to complement the needs of to complement the services being offered to address the needs of the community. In terms of confidentiality, nabanggit kanina if there are any confidentiality issues during the pandemic. We had reports around, kasi nga since the patients are not able to go to the clinic to refill and to even sign PhilHealth documents, there were reports around PhilHealth documents being sent to the patient, but the said documents are not sealed. And these documents, ang forms na ito, meron na yung nakaprint dyan na ang disease ay HIV/AIDS, halimbawa. So may mga reports na yan na nakikita ng courier yung ng rider yung document. And yung mga ganyang issues ang na-encounter natin in terms of confidentiality. Meron ding issues around, I'm not gonna name drop, no? Pero there were issues around delivery services na multiple stops to maximize the efficiency of a delivery route, for example. So say nag-deliver ka sa street A, then nag-deliver ka later sa street B, then street C. There were reports around street A, B, and C patients na magkakakilala pala. And nakikita sa sign-up sheet na same paper ang pinag-sign-upan. These are confidentiality issues na sana na kung sino man yung nakukonsult sa atin sa community ay na-anticipate natin yung possible effects of impact of forms being rolled out. Now we understand that there are needs around reporting and around mga ganyang sign-up sheets. Let us just consider the impact it has on the confidentiality and ultimately the mental health of our community. Going to mental health naman, we have had reports around like what we said around patients not in the best, not in the peak of their mental health because of the lockdown. Efforts were done around conducting webinars and online sessions that started as early as March last year. Then eventually it became a weekly, it became an every Saturday session na may webinar kami across different topics from basic HIV sessions to ARV 101 to mental health and every other possible issues that we normally give to that we can give to our community, we would come up with. Two, of course, number one, primarily to educate them, and number two, to give them that sense of community na nandudun pa rin tayo as a community na while services are greatly affected, nandudun pa rin tayo online to provide for services for the community. The ARV delivery may have been affected, but we still acknowledge the effort of the different clinics who stepped out of their comfort zone to provide for, sabi nga ni we provide for ARVs of other patients from other clinics. So we want to acknowledge them for that. Furthermore, there were efforts taken by private clinics like Sustained Health Initiatives of the Philippines, who is and was one of our partners in ARV delivery. Na they don't normally stick to just one bottle, lalo na kung ang papadala namin ng LBC is nasa probinsya. They can extend to 2 to 3 bottles outside of the protocol na dapat 1 bottle lang kasi nasa guideline. Yung mga efforts na ganon by civil society organizations and partners are what kept us going through the COVID pandemic. Thank you.
Thank you, Drew. You mentioned quite a number about mental and psychosocial services. No, there is one question here that I'd like to also raise. Merong concern is may question, what about the psychosocial needs of various PLHIV groups, especially the elderly? Was there any difficulty accessing services by this group? So vulnerable din sila. So can you share your experiences?
And maybe we can also answer both elderly and children.
And children, right.
Yeah.
Yes, thank you. And that's a very good question. No? Program-wise, we have been, I think even OE and the rest of the Network Plus and Network to Stop AIDS Philippines, we have had our eyes on programs around HIV and aging. This is one program component that we have yet to touch on and really fight for in terms of advocacy and program inclusion. mukhang hindi pa nakikita ng Pilipinas yung pangangailangan ng HIV and aging programs, while there have been little efforts from different civil society organizations to come up with small programs. Hindi pa siya institutionalized sa programa natin. It's something that we need to push in terms of advocacy sa ating mga partners sa iba't ibang ahensya na tumutugon sa pangangailangan ng HIV community. Sa children, thank you for mentioning that because I missed that part. There are constant effort around children born with HIV na pag-provide sa kanila ng mga supplements na need nila, and even mga prophylaxis and mga prescription meds na kailangan nila. Meron tayong mga organizations na constantly nag-work with them, but we were able to, around August or September last year, partner with the Corporate Social Responsibility Program of Philippines, and nagkaroon kami ng pagkakataon na to go around Region 4A and NCR and visit them in their houses and give them basic necessities sa groceries. Mas hindi man ganun pa kasapat, pero mas maraming atensyon ang nakatugon sa mga children kumpara sa mga aging, sa mga people na say living with HIV na in their 50s or 60s. So pero again hindi pa rin maingay pa rin yung pananawagan ng mga organizations na tumutugon sa pangangailangan ng mga kabataan na pinanganak na may HIV para sa mga programa at masustain yung mga pangangailangan nila at ng mga pamilya nila.
Thank you,
Sige,
Drew.
sir. Add-on lang siguro, sir. Sige, i-acknowledge na rin po natin yung ginagawa ng DSWD. During kasi the pandemic ay instead na ang mga PLHIV pumunta sa office ng DSWD office, ay instead na pumunta sila, ang DSWD staff po ay pupunta na po sa mga NGO para sila doon na po mismo pupunta ang mga PLHIV para magbigay ng medical assistance, financial assistance para sa mga PLHIV. Yun po. Ito po ay aging man siya or children man siya, ay pwedeng maka-access ng assistance galing sa DSWD. Basta complete lang po yung requirements na nire-require din ng DSWD. Yun lang po.
Sige. Tony G, would you like to add?
Yeah. Yun na nga. Ngayong pandemic na to, nakita natin ang importansya ng mental health at dapat natin i-integrate ito sa advocacy natin because there are some CSO or community-based organization na hindi talagang handa how to deal with our clients na may issue on mental health. It's because siguro naka-angkla tayo doon sa counseling, doon sa motivational dialogue, pero hindi natin ni mainstream din ang kahalagahan ng mental health. And this is something that I personally wanted to lobby dito sa amin, no, na to integrate the psychosocial and mental health thing sa HIV programs po. Yeah.
Thank you, Tony G. Irene, meron ako nababasang question eh. This is for everybody. Is there any online program accessible for persons who wanted to have counseling about possible HIV infection? Siguro ito during the pandemic.
Can I go first?
Yes.
Yeah, please, Tony G.
Because of the restriction of the movement, and at the same time, parang hindi ina-allow outreach activities sa community, the Moher organization, kami dito sa community center, we decided to engage sa mga, or yung visibility sa mga online platforms like yung mga dating apps, yung Grindr, sa Facebook. Doon na namin dinadala, and most of our clients doon na namin nakukuha sa kanila. So visibility-wise, yes po, meron na tayo sa mga, I think marami ng mga community-based organization na ginagawa na din dito. And we are also doing a online counseling and tele-counseling. So our CBS motivators, they are volunteers, no? Basically, they are volunteers. They are, I am trained by Hash, no? And dito sa Zamboanga, nag-roll out ang Department of Health to train more CBS motivators. And we see now the importance of CBS because of the restriction of the movement and because also the government defined the CBS motivators as one of the essential workers. So sila na mismo pupunta sa community. So this is something that pwede ko sabihin na naging best practice na akala natin noon it will be useless, but now nakikita natin ang kahalagan nila. And the CBS, yung community-based HIV screening, ina-address din niya ang gaps, yung numbers nga ng testing because of there are some clients who cannot go, hindi sila pwede pumunta sa mga testing facilities, and because of the CBS motivators, sila na mismo pupunta sa ating kliyente. So yeah, it's very important as well to highlight yung mga best practices dito ngayon sa amidst pandemic, no? Dito ngayon sa pandemya.
Thank you, Tony G.
Siguro, sir,
sige, si Owie, would you like to?
Siguro, sir, for example po, yung PLHIV Response Center, kasi kahit wala pa namang pandemic, ay PLHIV Response Center hotline ay nandyan na po siya. At mas pinalakas po siya during na nagkaroon ng pandemic ng COVID kasi yung online platform ng peer-to-peer approach counseling ay nagagawa na rin po siya ni PLHIV Response Center kasi most of them ng volunteer staff ng PLHIV Response Center ay mga PLHIV din. So every time na mag-queries about sa status nila or any queries nila ay handa po sumagot din ang mga volunteer staff ng PLHIV Response Center. Kaya nasasagot din po ng mga PLHIV Response Center yung mga queries ng mga nagtatanong sa amin. Yun lang po.
Thank you, Owie. Maybe we can go back to Drew about the hotline.
Yes, sir,
At saka, I think you can also respond. You can also respond to the question here. Is there an existing manual of procedure for HIV care? So if no, what efforts are being made towards this? So pakidagdag na rin yun, Drew, para dire-diretso na yung sharing mo. Drew? Nawala si Drew.
Okay. Sir Jun, so in all fairness to all narinig niyo ba, sir?
Please continue. Yes, please continue. We can hear you clearly.
Hello?
Yeah, continue.
Hello?
Continue, Drew, please. Medyo challenging ang internet connection ni Drew. Drew?
Hello?
Yeah, please.
Hello?
Hindi niya tayo marinig. We can hear you, Drew. We can hear you.
So in all fairness to all organizations naman, the pandemic has brought us Yeah, can you hear me?
Yes, sir. Mm-hmm. Yes, true.
So, hello? So yun nga, in all fairness to the organizations, I believe it's safe to say that most of the organizations, if not all, has turned to social media to provide for services, prevention man or counseling for the positive COVID. Has
So medyo challenging ang connection.
I think he got disconnected po. But maybe we can go back to him later.
Sige, please.
But to move forward lang, I was wondering if the panelists can also talk about the key role players that has helped them address the challenges, because they were talking about the innovations na ginawa nila, no, nag-shift to delivery services, nag-shift to online platforms for the provision of mental health services. I was wondering if they can identify key stakeholders, key institutions that were able to help them. And I ask this because we can use what we've learned from the different institutions that played a big role during the pandemic moving forward, no? Kung ngayon nakita na pwede palang mag-coordinate si iba't ibang CSOs to provide ARVs, then you know, we can learn from this and do it post-pandemic. So I was wondering if you can talk about who helped you, what resources helped you, the social media, technology, to address the challenges.
Additional stakeholders, because some of them you've mentioned earlier. Maybe you can add more stakeholders that were able to help you during the pandemic. Sige. Ovi? Nag-unmute si Ovi.
Andiyan na po si Drew. Sige po. Siguro sir, ang akin yung sa PLHIV community, yung with pandemic, without pandemic siguro, kasi nakita natin yung concern, lalo na sa ERV concern, baka kailangan natin talaga ilatag sa stakeholder partners o sa PLHIV community group na kahit walang pandemic, baka dapat talagang isama sa OHAT, i-charge ang courier delivery ng isang ERV delivery ng isang PLHIV, kasi lalo kay indigent talaga yun yung big concern ngayon sa mga PLHIV communities, lalo na kung wala silang pinaghahanap buhay na pinagkikitaan. So dapat sana matulungan kami o matulungan ng mga stakeholder partner na mailatag yun, ma-implement yung sa lahat ng treatment hub, yung ERV delivery na i-charge sa OHAT. Yun lang po.
So this is advocacy, like an advocacy to PhilHealth, no? Through the Department of Health, siguro. Sige. PhilHealth. Yeah, Drew is back. Please continue, Drew. Sorry for that.
No, I'm sorry. I'm in the province right now. Okay. So we already mentioned OHAT. No, OHAT is the Outpatient HIV/AIDS Treatment Care Package for PhilHealth, which is in line with the national guidelines for HIV treatment. To answer the question kung meron ng HIV care na written protocols, we have the national treatment guideline naman. At kasalukuyan din itong ina-amend at pinag-uusapan para ma-update ito at mapalawak pa ang sakop ng serbisyo na nasa sa loob ng national treatment guideline na ito. To respond naman to the partners, the COVID pandemic has shown us na maraming partners ang nag-step up. Nabanggit ko kanina ang National Council of Churches of the Philippines, nabanggit ni Owie ang TLF Share, and TLF Share is still up until now supporting us across different programs. In fact, itong activity namin ngayon dito sa Rizal is a TLF Share funded activity. Youth Voices Count is an organization that got funding last year, a grant last year. They partnered with many organizations to provide for PPEs. In our case, sa HASH, they provided for PPEs, and PLHIV also stepped up. Nakapagpadala kami ng condoms and lubes sa mga partners na nangangailangan ng condoms and lubes sa lugar na hindi na inaabot ng mga serbisyo, katulad ng sa Tacloban at sa Dagupan, sa Pangasinan. So, at even sa Ilocos Norte. So, sa mga network, nabanggit ni Owie kanina ang Network Plus. Network Plus has been a very active network of organizations pushing for the betterment of services and quality of life among people living with HIV. Ang Network to Stop AIDS Philippines has always been there to advocate for the community's rights. And lastly, dun balikan ko lang yung sa mga nakasulat na mga proseso, protocols, kailangan lang natin i-push pa ang multi-month dispensing. Nabanggit kanina ni Owie na may mga nag-i-issue dati ng isang buwan lang at that's a fact naman talaga. While the NCR's issuance averages 3 to 5 months daw, I learned yesterday during a meeting, the fact is may mga practices pa rin na one bottle nga, and it's not just the inconvenience that we are worried about. It's the fact that this might discourage clients or patients from doing their refills kasi nga para sa kanila hindi lang usaping gamutan ito, usaping ekonomiya rin na pabalik-balik ako sa mga treatment hubs para lang mag-refill when in fact wala akong trabaho, halimbawa. So kasalukuyang sinusulat ang multi-month dispensing protocol for ARVs among the HIV community. Sana ay maitulak natin ito. Yes, pinaparinggan ko si Owie sa PINAC. So sana ay maipush pa natin ito para mas mapastabilize pa natin ang issuance ng mga gamot at ma-standardize natin yung number of bottles sa iba't ibang mga clinics natin. Yun lang po for now bago ako ma-disconnect.
Thank you, Drew, for your sharing. Meron bang gustong idagdag si Tony G or okay na?
Yeah, thank you. No, dito naman sa amin, no, we are so blessed because we got the support from the Department of Health Region 9 because our organization, we are a volunteer-based organization. So basically, walang-wala kami. No? So because of them, they are helping us with the commodities and with their trust. So ayun, nagagawa namin yung for the community. And also, I would like to thank as well the Love Yourself Incorporated, no? Because when I proposed to them the Ronda Mujeres, sila ang isang organisasyon from Manila who helped us, no, to realize the Ronda Mujeres and the Global Fund as well, since we are part of the ACER project ng Global Fund.
Prof. Irene, please.
Sir, dagdag ko lang po na tanong sa panel natin, no, bago tayo mag-move dun sa sulat na natin na question. I was wondering if you have any experience providing services to PLHIV who are incarcerated, yung mga nakakulong po natin na members ng community. Because now, from your stories that you've shared with us, mas more focused siya to those in the community sa labas. But I was wondering if you have services for the incarcerated po natin or yung mga nasa in-house po na PLHIV natin.
Yeah, I will go first, no. As far as I know, the treatment hub or like dito sa Zamboanga, the Zamboanga City Medical Center, meron silang direct contact with the BJMP, yung sa mga penal farm, no. So basically, the clinic from the penal farm or may a contact na with the treatment hub and may mga mekanismo na sila na yon. So if you talk about the community-based organization na kakapasok doon, hindi na namin yon ginagalawan. Pero when it comes to testing, yes po, we go there, we offer our services of testing and counseling. But when it comes to treatment hub na at saka yung administrator or the clinic from that colony, sila na ang nako-coordinate.
Thank you, sir. Sir Owie, si Sir Drew, if you have experience lang po providing services for yung incarcerated natin na members ng community.
Siguro Ma'am Irene, same with Tony G. Ganun din po yung dito sa NCR. Sa PGMP kasi meron ng mga partners na nag-handle ng mga PLHIV na kaya nakakonect agad sila sa treatment hub. For example, wala ng ERV yung isang pasyente or may needs ang isang PLHIV. Sinasamahan ng PGMP pumunta ng treatment hub or minsan ang treatment hub ay pupunta doon sa PGMP para kumustahin at pasyalan yung isang PLHIV na nasa prison. Yun po.
Drew?
Okay. In our case, we work closely with PDLs or people deprived of liberty, as well as those in closed settings, like drug rehabs. Having a close relationship with people who inject and who use drugs. Tama si Tony, no? Pagka existing clients ito, normally yung mga LGU clinics doon sa concerned close setting ang nag-handle ng treatment. There are protocols around the clinic going to the closed setting, or vice versa, the patients going to the clinic. However, we have had cases where patients who were arrested or who were involved in a raid probably and are not able to disclose their status inside the closed settings. We provide services by reaching out to them and reaching out to, with their permission of course, reaching out to the management of the closed setting so we can provide for their meds. However, there is a need to expand to institutionalize these kinds of services and protocols to make sure that in the event that something like this happens, what do we do automatically? We do have JLO or Justice Access Learning Officers under the Global Fund who we can approach for legal issues like that. Still, someone messaged me kanina na what can we do pa. It's always good to have something written for protocols in cases of calamities, in cases of, say, another COVID or similar to COVID na experience, or yung mga ganyan na suddenly na-arrest or nakukulong for whatever reason. It would be good to have a set of written protocols so we're not caught by surprise doon sa mga nangyayari. May process tayo kasi very reactive tayo ngayon sa mga ganito eh. Like when COVID came out, nagkaroon ng lockdown. I think the interclinic refill memo came out towards the last week of May na. So dun lang nag-start formally na o pwede mag-refill sa ibang clinic. So and since that was a memo, may expiry siya. Hindi siya talaga naka-institutionalize. So we would want to have these things written para wala tayong biglaan na may experience tapos very reactive tayo. Anong gagawin natin? Yun po.
So ito yung isa sa mga policy issues no na kailangan tugunan din later on. Na related also dun sa question about policy dun sa chat box natin. Sige, Tony G, please.
I just want to relay because the regional coordinator of Department of Health Region 9, Ms. Clarissa Jose, sent me a message, and I think I'm not the right person to answer that because I don't have the knowledge. Maybe Owie or Daddy Drew can answer the question. Yung tanong ni Ma'am Claire is, do you have a knowledge about the mandatory testing among the armed forces as a requirement for entry or for an application for a higher position?
So would you like to respond to that, Drew?
Yes. We have had reports around mandatory testing, not just with the AFP, but with even med schools and other private establishments. Walang case ang magpa-prosper kung walang magfo-formal file ng complaint kasi. Para kasi from our perspective, these are all annotations or kwento-kwento lang. Kailangan merong mag-file para matest natin yung batas, Republic Act 11166, para maitama natin yung sa tingin ng batas na according dun sa batas ay hindi dapat ginagawa. If these are in fact happening, someone has to step up. Yung nagawan ng mali according dun sa batas ang dapat mag-file. And if we don't get the courage to do so, these things will keep on happening. Unfortunately, hindi natin sinasabi na wala kaming magagawa kasi hindi kami makakagalaw. May magagawa tayo, kailangan lang may mag-trigger na aggrieved party. So we need that para matest natin, magamit natin yung batas na 20 years nating ipinaglaban para ma-amend from 1998. Finally na-amend siya late 2018. Tapos 2018, 2019. Tapos hindi naman natin magamit kasi nga may stigma around using the batas kasi. So we really need to use the law para mailaban natin yung karapatan natin.
We need people to come out and file charges. Now, which is related to the question raised by Dr. Simbulan. Do your organizations engage in systematic documentation of violations of the rights of PLHIV, which I believe have increased under the pandemic? Meron bang mga ganong na-report sa inyo na mga human rights violation among the community?
At nare-record ba natin siya?
Na-document siya. Na-document ba siya? Sige. Owie, would you like to go first, Owie?
Sa Pinay Plus, sir, siguro yung PLHIV response center namin is a documented basis kasi ito yung naging evidence ng mga queries na may database kasi kaming pinafollow na doon, pag may mga issues concern na arising siya, doon namin kinukuha yung mga data para i-present doon sa partners o sa programa ng Department of Health na ito ay may concern at may issue ang sa PLHIV at ito yung evidence base na nangyayari at nakikita sa mga PLHIV, lalo sa pagdating sa legal concern. Kaya nakakonect po ang TLF share at nakasuporta sa PLHIV Response Center. Kasi yung legal concern po ay nandun po yung data namin pag may mga queries and concern po na na-release doon. So it's a part of our evidence base po.
Okay. Drew, you wanted to say something earlier?
Hash has a database of all concerns coming in kay CBS yan, testing, treatment, complaints or legal issues. However, I believe that the human rights database is database building is a mandate of TLF under the ongoing Global Fund round. Again, kung walang magre-report, wala silang mai-document. We have had cases where initially magre-report siya kay Hash, pero when we want it formally documented, that's if that's a cycle that we're going through, hindi siya ma-document eh. So, pero maganda yung initiative so we can document and we can eventually come up with more policies around these documented experiences. Challenge lang talaga mag-document sa stigmatized community talaga.
Okay. Thank you, Drew. Gusto ko lang i-segue yung sa COVID-19. Since this is a COVID-19 and HIV, but although there's a session on vaccination, but we wanted sana to get your experiences, your perspective about access of PLHIV community in the COVID-19 vaccine, which is related also to the question raised in the group chat. At sino yung pwedeng mag-administer ba dapat nung? Meron ba mga issues related to access? And if there are issues, who should be administering the COVID-19 vaccine to the community? So anybody can respond to that. Drew, ikaw na, Drew. Baka ma-cut yung ano. Mahirap talaga yung ano ni.
Mayroong merong
Drew, we can
order or department order where
Drew,
the hubs, the treatment hubs.
medyo ano no, bagal yung ano ni Drew. Can we listen from we'll go back to you, Drew. Sorry. We can't barely hear you. Can we hear from Tony G and then Owie? Tony G?
Yeah, okay. Yung first muna, gusto ko lang dagdagan about the documentation of human rights violation.
Okay, please. Thank you.
Yung more LGBT organization, meron po kaming DALO, yung sinabi nga ni Sir Drew kanina, the Justice Access Learning Officer, na kung saan siya mismo ang naka-assist sa mga PLHIV friends natin, no, if ever their rights were violated. And the more since nag-start kami, we are already documenting and monitoring cases of human rights violation perpetrated by the state or non-state actors. And we are also providing legal representation to our clients who cannot afford to have one. And doon naman sa COVID vaccine, as far as I know po, meron na tayong guidelines galing mismo sa Department of Health na kung saan pinapayagan ang mga PLHIV to get their vaccine, no? Actually, nandun sila sa category A3 with comorbidities. No, however, there are PLHIV who doesn't want to disclose their HIV status mismo doon sa vaccination center. That's why ako basically, I have some friends who are PLHIV pero they doesn't want to go to the treatment facility to ask for the medical certification or to check their CD4 counts or their viral load. Instead of pupunta sila diretso sa vaccination center at chinecheck lang doon ang BP, kung normal yung BP, shoot na kagad sa vaccination. So, yeah, kung anong nakalagay doon sa guidelines ng Department of Health when it comes sa PLHIV to get vaccination, I think mas maganda yun kung pinapractice lahat ng mga vaccination center.
Thank you, Tony. Owie?
Sige, sir, add-on lang din kay Tony Z. Ang malaking concern kasi natin dito sa Philippines, sa NCR, hindi lang sa NCR, nationwide, siguro yung vaccination ng PLHIV kasi pagdating sa survey kasi natin, yung confidentiality, may issues pa rin doon yung nakalagay yung HIV status. So, malaking issue siya sa mga PLHIV community pagdating doon sa survey form. Although, alam naman ng vaccinator na confidential yung status na yun, pero yung hesitant pa rin ng mga PLHIV ay hindi pa rin naman siya nawawala. Kaya kung titinapin natin, mababa pa rin yung mga PLHIV na nagpapabaksin kasi una yung takot nila sa vaccine ng COVID. At pangalawa, yung disclosure nila na rin as a part ng confidentiality. At although naglabas na rin ng guidelines ang Department of Health in terms na pwede na magkaroon ng vaccination ang mga PLHIV sa treatment hub. Pero hindi pa ata po nakababa sa lahat ng treatment hub, yung guidelines na yun, o kung meron man, ay hindi siya malinaw pa na hindi siya implemented pa doon sa lahat ng treatment hub, yung vaccination with sa treatment hub for PLHIV. Yun po. Thank you.
Thank you.
Can I add?
Sige. Tony. Free-flowing tayo.
And dito naman, I just want to share about, since we're talking about the vaccination for the PLHIV, no? And in fairness dito sa amin sa Zamboanga, particularly the City Health Office, they already nag-roll out na sila for the vaccination for the PLHIV. And according to my friend, parte din siya doon sa vaccination program ng ating city, very very discreet and successful. So nakikita natin yung importansya pa rin na dapat yung mga services natin for our community ay client-centered siya. So we have to think about their welfare as well. Because yung sinabi ko nga kanina, not all PLHIV ay alam na ng pamilya nila, or not all PLHIV are comfortable to disclose their HIV status to the public. Yan.
Thank you, Sir Tony G and Sir Owie. And hopefully we can get Sir Andrew back. No, just in the interest of time, we have 10 minutes left for the webinar. I was wondering lang if to close the open forum na yung discussion natin. I was wondering if you can provide your key takeaways from your experience during the pandemic, and also how you would want services provided to the community post pandemic, kasi nabanggit natin, 'di ba, ito yung mga experiences natin, ito yung challenges, ito yung mga na-learn natin, ito yung mga bagong services that we came up with to adapt to the pandemic. We would want to hear from you also, ano yung mga gusto nating mangyari moving forward. Kumbaga kung may wish list tayo
support
moving
needed.
forward, ano ito, at para maiparating natin to the key stakeholders, no, ng HIV care cascade natin in the Philippines. I'll probably start with Sir Owie, and then Sir Tony G, and then hopefully we can get Andrew back, no, to give his closing statements. And also Sir June tayo din mamaya before we proceed with the next part of the webinar.
Siguro po, Ma'am Irene, ang akin lang yun siguro yung sa mga PLHIV community, huwag silang matakot. Kung meron silang hesitance pagdating sa mga services na lalo may pandemic ngayon, may mga programa like mga CSO partners natin na handa naman tumulong at handang sagutin yung mga concern nila. Nandiyan po ang PLHIV Response Center hotline, andyan po ang hash, ang PLF share. Pagdating sa legal concern ay willing naman po tumulong. Kaya siguro in terms po sa, yung lagi ko sinasabi yung sa OHAT natin, yung out sa PhilHealth na yung courier ng kahit may pandemic o wala, sana sagutin na lang, i-charge na rin isama doon sa OHAT. And then maging accessible yung concern ng mga PLHIV ngayon, like yung viral load, yung CD4. So yun yung malaking concern. Concern kasi ngayon na nawawala din sa treatment hub, na maraming queries sa PLHIV Response Center na nagtatanong na kailan ba magkakaroon ng availability sa CD4 at viral load ang treatment hub. Yun na po. Thank you po. Sana maging malinaw po sa lahat yun.
Thank you, sir. Si Tony G.
Yes. I think this time around, let's bring the services sa community. Dapat yung servisyo natin, hindi lang siya pwede i-access within the four corners of the facility. It's time for us to bring the services sa community, especially not all our clients na may kayas. Like now, because of the pandemic, marami tayong mga kliyente or mga PLHIV na wala ng trabaho, so affected. So we have to think out of the box. Second, we have to empower our PLHIV community na because within the community up to now, yung discrimination nandun pa rin, yung stigma. And within the community up to now, they still stigmatize the facility. Na dapat i-empower natin sila that the facility is, sabi nga ni Owie, is the one who's helping you. So we're not supposed to stigmatize it. And lastly, let's normalize to talk about sex. I-normalize natin yan, isali na natin yan sa usapan sa pamilya, kapag kumakain ka pa sa merienda, because ang sinasabi natin palagi, HIV is not a death sentence. The sooner you know, the better you can look after yourself. Thank you.
Thank you. And Drew?
Is he back?
Yes, sir.
Hello.
Yes, Drew.
Hi.
Yeah, Drew. Oh.
Yeah.
Drew, nadinig mo yung
So,
parang key message, tsaka ano yung mga support na that need to be put in place.
yes, Sir June. Una, again, salamat sa pagkakataon for the community to share its insights, opinions, and experiences sa mga usapin na pinag-usapan natin this afternoon. I would like to highlight what Ms. Tony said earlier, yung client-centered. Sana lahat ng mga polisiya natin ay nakatuon sa pangangailangan ng community, base sa mga pangangailangan, base sa mga experiences, base sa mga naisusulat na mga documented nating mga experiences ng community. Secondly, tama si Owie around OHAT, no? But on top of that, we have been calling for so long for the OHAT transparency report. Nasa ng OHAT transparency report ng ating mga treatment hub. Sinasabi na dapat may 30,000 worth of services, 20% goes to the hub, 80% goes back to the community. OE is saying, is asking for the career services to be included. Again, what we want now is immediately is to access nasaan ang ginagastos na 24,000 for each patient. Otherwise kasi papalawakin natin yung OHAT, baka mapalaki na naman yung OHAT, which is good, pero again, walang transparency sa reporting ng ating mga treatment hub partners. So sana ay maisulong natin yung transparency requirement for the OHAT usage or utilization sa ating mga treatment hubs. And lastly, kung wishlist rin lang, sana ay ma-maintain natin at mapalawak natin yung serbisyo na interclinic na ginagawa sa ibang bansa. Meaning, hindi porke sa pasyente ako ng Clinic A ay hindi ko pwede i-access ang services ng Clinic B. Now, we understand na merong reporting issues ito, may mga documentation issues ito, pero sana hindi maging barrier ito para mapalawak natin yung serbisyo na binibigay natin sa community. In spite, sa halip ay we see this as a challenge para to better perform in terms of our information technology, in terms of our recording, monitoring and evaluation. Imbis na makontento tayo dun sa proseso natin na dyan ka sa hub na yan naka-enroll, dyan ka kumukuha ng ARV, hanggang dyan ka na lang. The fact is very mobile ang mga community members natin. We should not be limited from accessing services regardless of our location. So yun lang po.
Okay, thank you, Drew. Thank you, Tony and Owie. We've learned a lot, no? No, and I think this is we were able to attain our objectives. We were discuss extensively your experiences in accessing HIV care and services before and during the pandemic. You've discussed quite a lot on the challenges experienced by the community and what are the services that were mainly affected during the pandemic. And you also identified a number of stakeholders that were able to help. Now, partnership really is the key, coordination with the local government, with the DOH, and other civil society organization. Ang ganda, I'm learning a lot. And then you've also discussed a number of innovations that you used during the pandemic na nakita natin yung ating resiliency, no? That despite the pandemic, we were able to come up with innovative response that benefited our communities. So yun po, Prof. Irene, I bring back the floor to you.
Sa akin po, I have three key takeaways from the discussion. One is, we're very thankful to the community-based organizations sa services and yung innovations na ginawa nila. But we also have to recognize that more work needs to be done moving forward. We've made innovations, but right now they're not perfect. May mga issues pa tayo, and it's important that we learn from our experience so we can improve our services moving forward. Pangalawa is that I would just like to echo what has been said earlier by the panelists, na it's time to bring the services closer to the PLHIV, that we don't have to wait for them to come to us, sa service providers for services. Tayo bilang service providers have to reach out to them, bring the services closer to them. Kasi may mga limitations sa kanila in terms of accessing. So ilapit na natin, wag natin silang antaying lumapit, ilapit na natin. At panghuli, yung importance ng speaking up, ng providing feedback, documenting your experiences, and express your frustration sa mga kinauukulan, kasi kailangan nilang malaman ano yung nangyayari sa ground, sa community mismo. It is often viewed as problematic when we raise our questions and concerns, but really it's not problematic. No, it is essential that we do that. So yun siguro yung last point ko is we need to speak up and let the powers that be know what's going on the ground. Yun po.
Saka maganda
And,
din Prof. Irene, yung sinabi ni Drew na kailangan ma-institutionalize yung mga policies talaga, like yung access to ARV services across different treatment hubs. Maganda yon. That was parang the good point that happened after the pandemic. During the pandemic, na it became a more accessible. Okay, so what's next?
I think we're on the last part na, which is the awarding of the certificates, Sir Jun.
Okay. Okay, so we proceed to the awarding of the certificate of appreciation to all our 3 distinguished panelists. So may I have the certificate on the screen? Okay. So HIV and COVID-19 webinar series, certificate of appreciation. I'd like to read it. This certificate is presented to Owi Franco for sharing his knowledge and expertise as a speaker during the 2nd session of the HIV and COVID-19 webinar series on the ground, COVID-19 narratives and realities of the PLHIV community, given on July 17, 2021, signed Dr. Carmencita Di Padilla, Chancellor, University of the Philippines Manila, Professor, University of the Philippines College of Public Health, and Dr. Don Operario, Professor, Brown University, and also Director, NIH-Fogarty D43 Training Program for the Prevention of HIV in Vulnerable Population. So that's for Ovi Franco. So our virtual certificate, and the same certificate is awarded to Desi Andrew Ching, the same certificate of appreciation. Okay, and also the certificate of appreciation is awarded to Mr. Alvin Tony G. Fernandez for being one of the panelists here today. So thank you very much. Prof. Irene?
Yes, sir. Before we close, I would like to invite everyone to the 3rd webinar. Sabi nga natin kanina, this is a 5-part webinar series. We're not yet done talking about all the issues related to our experience of HIV during the COVID-19 pandemic. So kanina maraming questions and issues raised with regards to vaccination. And it's very important that you tune into the next webinar series, which is Who is Next in Line? Considerations and Guidelines in Vaccinating the PLHIV Community. We've invited representatives from the medical field and also from the legal field to discuss yung issues related to vaccination. So we hope to see you in that webinar. And if to promote the webinar series, we would appreciate it if you can also follow us on our social media accounts. We have a Facebook account, we have a Twitter account, and you can also get updates from Subselfie and Reporter, who are our partners. We'll post updates there, and we look forward to having you during our webinar series in future webinars. For those of you who would like to get certificates, and we of course appreciate your feedback, we would appreciate it if you can scan the QR code or put the link on your browser and give us the feedback through the evaluation form. Hopefully you can submit it on or before July 18. For those who are interested in the certificates, certificates will be issued to you after you accomplish the evaluation form. Since marami yung participants natin, it usually takes probably a couple days or to a week before you can get the certificate. So please bear with us.
Yung link nasa it's in the group chat now. They can just click the link to access the tiny URL.
Opo. So muli marami pong salamat. Thank you very much for joining us today. We hope that you have learned something from the experience of our esteemed panelists, and you can help. Hopefully, you can help us advocate for the betterment of the health HIV treatment and service provision in our country. Marami
Especially
pong
during the
salamat.
pandemic, yeah.
Yes, especially during the pandemic. Maraming salamat po.
Do we have a, so tapos na tayo, no, Prof. Irene? So we can ask the participants to log off. And then we will continue with our panelists. Do we have a group photo?
Yes, sir. May we please request for the panelists to turn on their video so we can take a group photo.
And also our organizers.
And organizers.
So somebody should count. IMS?
Wait lang sir, baka check ko lang kung nagbo-broadcast pa tayo sa Facebook.
There are still 100. This is, how many?
Hindi naman po nila tayo.
Hindi naman natin sila. Okay, sige.
Nakikita pa rin nila tayo, sir.
Kita nila tayo. Okay, hello.
Maraming
Thank you
salamat
very
po
much.
sa
Thank you very
pagsama.
much for attending our webinar.